call the meeting of August 7th of the Board of Health to order. The first item on the agenda under new business is the acceptance of the minutes of the June 5th meeting.
Motion to accept.
Second?
Second.
Thank you. All those in favor?
Aye.
Okay. The next item on the agenda is the monthly development services report submitted by Matthew Sheehan, our new Chief Health Inspector. I guess, is that your title?
Senior Health.
Senior Health
Senior.
Inspector. Okay, so the first part of your agenda is the August monthly food establishment inspection. The board have any questions on the August monthly food inspection report?
Nope.
Okay, is there anything you wanted to say about any of those that failed?
I mean, some of the stuff is just minimal. As you can see, I think it's on, it should be on the back of page 1. Wendy's, they failed due to improper maintenance of their equipment. It was a real mess out on Middlesex Street. We shut them down for 24 hours. It was actually closed by myself, and fines were issued to the business for improper upkeep of their equipment. So that's one thing that we'll keep our eye on, because what I didn't realize is Wendy's, Boston South, they're everywhere. Boston North, we think there's a lot, but there really isn't. So all their companies come up from the south, so it takes them time to get here. So that's pretty much why they got fined, because it's just, they need a better schedule to upkeep their equipment. There was nothing wrong with the food, it was just the equipment itself.
So it seems to me that we used to have a column that said last time failed.
Or last three.
Last, like, something about
Transmissions.
previous failures
Yep.
in this report.
Oh, okay, all right.
No, it was in this. If they
Oh, either
failed,
or, yeah, so
if they failed, what
failed-
happened the last 3 times, so we know whether they're just repeat offenders
Okay,
or
I
whether
can add
it's.
that, absolutely, yeah.
Great.
Yep.
Just so we, like, because we often request that the frequent flyers get re-inspected more often.
Okay, yep.
And it's just good to see when, so yeah, you're right, it's on the failed inspections. If you could just note, what, you know, the previous 3 infections, if they failed at all out of the last 3.
Absolutely.
What is the change of use on the lemon and thyme? It only says it for the.
So I call it
University.
change of use, it's a new owner. Like, they bought the existing, that little cafe that's inside the old Sun Building down the street here on Dutton. We just call it change of, it's categorized as change of use.
Any other questions from the board? Okay. Did you have anything else?
Do you want to bring up this?
Yeah.
About the tattooing, changing the.
Oh, yeah, sure. So I didn't know if you were going to ask the question about the tattoo shops.
Yes. So right now, currently, my office, we do tattoo shops, microblading, and body piercing once a month. Looking into it, there has been an issue in the city since 2008. So I would like, you know, with the board's blessing, to either move it to once every 6 months or once every year. I put in my notes that I contacted Worcester, Fitchburg, Springfield, and I didn't add this, but Cambridge actually called me back after I submitted the report, and all of those cities do once a year. But again, you know, whatever the board's pleasure is, I will follow that, the office will follow that. I mean, now, 2008, you know, everything was like the old school machine that you had to put the wristband, the elastic band around, and it had to be sanitized, it had to be put in autoclaves. Now pretty much everything is disposable, you know, what the tattoo artists use. I mean, much like a restaurant, tattoo artists, their places are meticulous because they have to be, you know, because of what they're doing. So it would be my suggestion to a year, but again, I'm open to, whatever the board feels is best, for the
I
city.
wonder what you would think of doing, since we're doing them monthly now, do them every 6 months, and then if in 6 months.
Or a year.
There's no issues, then go to a year.
Absolutely. We can do that. I'd be happy to do that.
So we're not like a year out and then find,
Correct, yep.
just the first time start at 6 months, and then we can at least say, well, and then if there are issues, we'll go, discuss it, but, yeah, I think that's reasonable.
Okay.
I don't know what the rest of the board thinks.
I think just to clarify, is this request is just the tattoo shops, not like the microblading? Because that's,
So it would be.
are we looking at
tattoo
separate or
shops-
both?
Would be tattoo shops, microblading, and the body piercing establishment on Central Street. I kind of lumped everything into one.
Okay.
But again, whatever the pleasure of the board is, I will enact that.
I agree with that, Madam Chair.
Do we need a motion?
Yeah, probably.
So motion for change the inspection of body art to once every 6 months?
Sure.
Okay,
I'll second that.
second, all those in favor?
Aye.
Aye.
Okay. Anything else?
That's all I got.
Okay.
Thank you very
Thank
much.
you, sir.
Thank you.
Welcome.
See you. Welcome aboard.
Thank you.
The next item on the agenda is a public hearing with regard to body art regulations. And we have draft final regulations of the body art. There's a couple of things that need to be changed. I don't know if Mr. Attorney McKenna would like to raise any issues or,
Yeah, thank you, Madam Chair. John McKenna from the Law Department, working with the Health Department. We've reviewed the regulations as drafted, and we do have one recommendation that I sent over late email. It's section 19.11. My recommendation is that you delete where the section says the fine for a violation of any provision of these body art regulations shall be no less than $300 per offense. To make it in compliance with Chapter 40, Section 21D of the Massachusetts statutes, it should say, we should delete be no less than and say shall not exceed. So each offense would be not to exceed $300. It could be $300 or less each offense, so if they continue, it would be per offense per day. And we viewed that with the city solicitor. He's in agreement, and he also wanted to note that, beyond the fine, you can suspend licenses. There's other remedies. There's criminal. This is for non-criminal dispositions, that fine. And there's also criminal remedies that you could have. And also you can revoke licenses. So that's our recommendation. There was one other recommendation that Kerry had with regards to the guidelines that I believe is in conformance with the intent of the publication, and she may want to just talk a little bit about that. But with regards to the regulations, that's the only change that I have the amendment on.
You need to vote on that separately.
so yeah, let's, do we have a motion to delete be no less than in section 19.11 and insert in its place not exceed?
I'll make that motion.
Second? Second. All those in favor?
Aye.
Okay. Okay, did you
Are
have
you
some?
referring to the definition? Oh, so during the, while I was prepping some of this to get together, I noticed that we discussed that the regs stated that you had to have a disclosure statement, but it wasn't in the definitions. So I added to the definitions, so it's in the copy that you received, number 3.27, and it just basically says that it's an advisory statement given to the client at each procedure and what it entails. So they should already be doing this because it's been in the regs right along. It's just we didn't have a definition of it there.
So that's 3.37, right? 327?
327.
So the specific language says Disclosure statement shall mean an advisory statement given to the client at the beginning of each individual procedure, advising the client of the risk and possible consequences of receiving body art procedures. Each establishment will submit a copy of the establishment's disclosure statement upon the establishment's letterhead upon initial license or upon renewal. And we already made them do this, we just didn't have the definition.
So I had a question about the ink. In some of the language, it says the ink has to be FDA approved, but then if you read the FDA packet, it says they don't,
They regulate it as a cosmetic, and therefore they regulate it for contaminants as opposed to actual as an ink. So if they, because I looked into it when we were going through it, because this is what we had originally. There's no change to the language from the initial regs. So that's the way the FDA, they don't approve it as an ink. It's like henna. Like henna is a hair dye, you're not supposed to use it on your skin. So they don't approve it for that. So the tattoo ink, they monitor it for contaminants so they can tell people to stop using it if something happens. So they have to, so as long as it's passing their inspections for contaminants, then it's kind of silent.
So does this language reflect that, or do we need to change the language to?
Well, the language is how the law department said to put it when we initially made the regulations back in 2008. There was no change to it.
No, I know, but if it doesn't reflect reality,
Well, it does, because like if somebody's using an ink and all of a sudden they find out it's causing rashes and stuff like that, the FDA can come in and say,
But-
stop, we're not approving that anymore.
what I'm saying is, doesn't the regulation say the ink has to be FDA approved? But technically, the FDA doesn't have any inks that they approve or not.
they can send out warnings if there's an issue.
If there's an
That's
issue,
what
they
I'm
send
saying.
out warnings, but
If there's not an actually approval by the FDA for the ink, I would just say change the wording.
it says
I
the
think-
FDA has not approved any inks for injection into your skin.
Which technically means you shouldn't be tattooing.
Correct, so we should
So
take that out of
that
our
means like
language.
all the tattoo shops would be illegal.
Where is that, what section is that?
So I did include whatever I found so you can have some background on it. That's like the attachments
Right,
there.
where in the regs does it reference FDA approved ink, do you know?
Yeah, I'd have to search for it. Hold on a second.
I think I highlighted it.
Only 100 pages long, so.
I know, and my hand doesn't.
Is it on the attachment, Julian, that, does it mention it anywhere in
In where? Here?
there? In, yeah, what is that?
This is, I mean, do we have to talk about this human remains thing or no?
It's becoming very popular. And I emailed you about it because Boston, Cambridge, and another town who's in the body art group I'm in are having people inquiring about this cremation tattoo. And it actually was online the other night, and somebody was having one done.
Oh, yeah, 15.06A says, doesn't really say
Doesn't say
FDA.
approval, it says with the requirements. so
Yeah.
That should be okay.
Yeah. Okay.
I assume, so you don't have any issues with this, right? So I would, yeah, it doesn't say approved, so I think we're okay with
Right, and that's how some of the cities are banning the memorial tattoos by having the human ashes instead, by saying it's, because it can't be adulterated.
But we have language that says that the substance cannot be added to the ink. Anything else with,
Which one now? I didn't hear. The department would be us. And then the FDA under the Federal Food, Drug, and Cosmetic Act, which regulates the contaminants and what they put into an ink.
Yeah, I would try to just leave it. So was there a motion to be made before we started talking about the ink? Was there
No.
another change you wanted to make?
No.
No.
Not yet. Then the other thing is the apprentice papers that I handed, to the changes that had to be made. That I passed out.
So is the plan to put them in their own section?
So in the apprentice section, there's a section regarding what tattoo apprentices need and what microblading apprentices need. And I think I accidentally put some of the stuff about microblading under the tattoo artist, and it just needs a motion to move whatever references microblading from the tattoo section to the microblading section, and we'll just move it.
Do they exist in the microblading section now, or are you just gonna move it to that?
So, yeah,
I- off the top of my
the
head, I
ones
think
that are
I-
highlighted, 4,
No,
7,
I
and
understand that
9.
it's a lot of ones to read while we're sitting here, if they're, I just
Yeah.
wanted to know, are they being moved to the microblading, or they already exist? But it looks like they don't exist there, so you're just gonna move them there. Okay.
If there already exists, I won't duplicate it, because there'll be no need to.
It doesn't look like they're in there at
No,
all.
probably, I
No,
don't think
no.
that they were.
So I'll make the motion to make that, to approve this with that correction, yes.
Okay, so, under the minimum requirements of the Body Art Practitioner License Program for tattooing, we'll move out the microblading requirements into the microblading section, which follows, should be under the requirements for microblading. Move the stuff in 4, 7, and 9, some of it, into the microblading section. Do we need a motion?
Yeah.
Do we have a motion to move those? I
Still
think you
made it.
made that.
Yeah, I made the motion, yep.
Second? Second. Okay. All those in favor?
Aye.
No other changes, we'll take a vote on the two motions that passed.
So we made the motion, we already made the motion
We
to,
already made the motion, so we're doing one vote for
To-
both motions, but it's approved.
so we're approving the whole packet now, is what you're saying?
Yeah.
I'll make the motion to approve the entire packet with those corrections, yes.
Second.
Is that Aaron?
Yep, yeah, Aaron.
Joanne?
Yes. Motion.
Bill?
Yes.
Aaron?
Emphatic yes.
Allison? Kathleen is absent, so passes 4-0.
Exactly.
And I believe I can sign as the attestation, and we can sign them all once the corrections are made at the next meeting, right, John?
Yes, that's correct. All right, thank you very much. If you have any questions, the law department's available. Nice to see you all.
Thank you for your help.
Thanks for doing that.
Was there anything you wanted to say? Oh, okay.
Oh, did you want to speak? They just voted on it. Did you want to speak on it? Okay, great.
We just lessened the fine if you're misbehaved, that's all.
The next item on the agenda is the Tobacco Control Monthly Report. And are there any questions on the Tobacco Control Report? I did have a question about the item that I thought was going to be on the agenda that was raised to us by Megan's House. And so I guess that's going to be on.
Yes. So Caesar will be here next month with recommendations for the Kratom. So he'll be here next month with recommendations for the Kratom, and he will have the, I believe it's 7 public hearings for next month. So he'll have all of that for next month. And then if you have the recommendations to change, if you decide to do any changes for the recommendations for the Kratom, there will be a public hearing the following month. For the Kratom? Right. To make any changes to the ordinance for that, that will be the following month.
Okay. Any questions on the tobacco control report? Next item on the agenda is the animal inspector nomination of Mr. Andre Caraballo as the City of Lowell Animal Inspector. Do we have a motion to approve the nomination?
Is he new? Are there any concerns or issues? Guess I'll make that nomination, or make that,
Okay, we have a motion to
Motion.
nominate Andre Caraballo. Second?
I just need a vote.
Yes.
yes,
Yes.
The next item is just informational, the monthly mosquito spraying and program information. Any questions on the schedule for mosquito spraying? Maybe the director would like to talk about mosquitoes.
Yes, thank you, Madam Chair. So we did get word recently that Lowell has a positive mosquito for West Nile virus. It is in the northeast section of Lowell, so we have arranged for some spraying, which will include quite a large area for tomorrow evening. At 6 o'clock tonight, there was a reverse 911 call for the area that will be impacted, and then they'll get a two reverse 911 calls tomorrow. It was posted on social media today, and then it will be posted on the Lowell Public School webpage tomorrow, because it's going to include 3 schools that we're going to have sprayed. We're also going to spray Shed Park in preparation for some of the sports that will go on there, and then Colley Stadium for the beginning of football season, to try to get them before their fall sports start. The state also had their first case of West Nile virus this week in a human, and their first case of triple E in a horse this week. So there's been significant mosquitoes trapped in the state over the last, I believe, 3 weeks. There's also, in here, we've been doing sprayings from June, July, and August, and the dates for August are in here. It's every Wednesday.
Right, and if anyone listening is interested, you can also call the Central Mosquito Control Project, Central Mass Mosquito Control Project, to request spraying, or also to report any pools that have not had any attention, or stagnant water.
Yeah, they'll go and put herbicide into unused swimming pools to prevent the larvae from.
And just for informational purposes, the Central Mass Mosquito Control Project phone number is 508-393-3055. The next item on the agenda is the Pride Star EMS, Pride Star Trinity EMS overdose reports are included for May and June. Here's the May and June numbers are up a bit. Any questions on the overdose reports? Next item on the agenda is communication from the Commonwealth of Mass Executive Office of HHS, DPH, dated July 9th, regarding new fish consumption advisory, advising high-risk groups that PFAS were found in fish from the Concord River, and containing mercury and other chemicals, and that children under 12 and people who are nursing pregnant or may become pregnant not to eat any fish, and others to limit the consumption of largemouth bass and other species to 1 meal a month. If anyone has any questions, no. Okay.
Put them in Merrimack, I guess, the need fish in there.
But if they've tested the Merrimack fish or not. Next item on the agenda is just communication from Aries Engineering, and then Tetra Tech regarding, just reporting that they have to do with regard to disposal sites and Superfund sites and follow-up that they're required to do every 6 months. Apparently, Aries Engineering, when called, said that what was detected recently has been decreasing, and they're all below the concerning limits. Any questions?
Did you call them?
Yeah.
Did you guys call them?
Carrie called them. Because I just had a question, I wasn't sure how to interpret the information. And
I called the first group, and then I mentioned the Aries report to them, and that's what the guy, they both work for the state.
Right.
the next item on the agenda is the Lowell Water Department Consumer Confidence Report. I'm just talking about the good quality water that we have. And then under the next item on the agenda is the Director's Report.
So I believe, Madam Chair, one of the things that came up was the Pawtucket Memorial School. And last year, the Pawtucket Memorial School wasn't ready to open due to the mold concerns. And there was something at the City Council concerning about one or two of the rooms may potentially already be, have mold in them. So I did speak to Rick Underwood, I believe last week. They are going to test every room again for mold. We haven't gotten any of those reports since they'd been negative for so long. So that should be coming out shortly. So we should have that room to room. And it does take a while because they have to go in and then run all the results. So it does take a while to get all those results back. The City of Lowell is doing a lot of work. They actually had a hard time running all of their summer school programs because they're doing significant work on a lot of the roofs, air conditioners, boilers. They're paving a lot. They're doing a lot of work in a lot of the schools over the summer. So there is significant work being done in a lot of the schools that the board has been very concerned about for years. So they are getting caught up. And I did hear Superintendent Liam Skinner talking today that they, Catherine Moses is our energy, I don't know what her title is, but she does energy efficient things, and they just got a very large grant, and that's going to pave way to get more grants for different things. So he was talking about that today. I believe they just got it yesterday. So that seemed to be something that he was very excited about for some things that will go forward were to get the buildings in better shape. So I believe some of it is for windows and ceiling doors, which will help with our mouse problem. So not probably for our September report, but hopefully going forward. So that will be good. Another thing since our last meeting, the state of Massachusetts had their first measles case, but we have had a nurse in the Family Resource Center reviewing records for the summer, so hopefully a lot of our records will look good going into the beginning of the school year. In Nicole's report, they did do a TB screening at the ICC, and that also included vaccines for the kids. So they did do 29 vaccines for 29 children. Some of them were like little kids and then other kids, but a lot of parents brought their children down and had the records screened. So they were looked at, so those kids didn't need shots, which is great. So that was great that they were at least being looked at and know that the kids were up to date for their shots.
So the nurse at the Parent Information Center is from the health department?
So she actually works as a substitute nurse for us, but she's hired 18 hours a week by the school department as well.
Great.
So she has 2 roles.
Great.
Yep.
So they're getting a head start on vaccine.
Well, she's actually been doing both roles for the last year. So she's been doing it, but she also works during the summer for them.
Okay,
Yep.
good.
Win-win.
Is there a time frame? Not to change topic, is there a time frame for the high school position? When's that supposed to be?
I can get it. There's going to be a presentation this Tuesday. There's different steps to it.
Right.
It's online, and there's different steps to it. I don't know if you know, Madam Chair.
I think we're 2 years out. August 13th is going to be an update on where they're at.
Yeah.
The superintendent said this morning that
Yeah.
it was on schedule.
Yeah. Let me see what else I have. So I have that one, and then, so we do have 2 new full-time nurses that will be starting for the start of school, and then we have some interviews this week. And then Andres, we finally hired a new full-time syringe coordinator to work with Andres, so we have 2 full-time syringe coordinators working. So it doesn't reflect the numbers this month, but it will reflect the numbers next month. And then if you have any questions for me?
I, of course, have a
Sure.
question on the public health report.
Yes.
Actually, a couple questions. So one question, you talked about the screening done at the ICC.
Yes,
So 5 of the 10 adults that they tested for TB were
Yes.
positive.
correct.
And so the suggestion in Nicole's report was that it may lead to the suggestion that there's need for more adults to be screened.
Correct, yes,
So is that a plan? Is that being done? Do you know?
yes. So we're hoping that we have another date. The date hasn't been set, but we're hoping for another August date. It's voluntary for them to do it. So when we had the children's vaccine, and the kids were going to have the test done, we were able to coerce the adults to have it done. If we only do an adult clinic, it's hard to get the adults to come down. Knowing that we had the kids there, we could get the adults to come as well.
Are they afraid, they know if they're positive, they're not going to get reported, right? They're not afraid to be reported because it's positive, are they?
No, it's just that there's no
incentive.
no incentive, correct. Yeah,
They're getting the vaccines to get the kids into school.
correct,
bringing the
correct.
children down.
And then it's so your child needs a vaccine to get into school, and since they're here, how about if they have their blood drawn as well? And then since they're here, why don't you do the paperwork as well? So it was a family package, so it worked very well, getting everybody done at the same time.
And we still have TB services that those 5 positives were referred to.
Yes, Lowell General has increased who they see, and and Lowell Community Health has been very helpful as well. Yep.
Do we have dates for the flu vaccine?
So I should have written them down there. So our flu vaccines are going to, our flu clinics, I believe, are going to be it's right around Columbus Day. So I can't remember if it's immediately the one at the health department is going to be the Tuesday after Columbus Day. So I want to say the 14th of October, but I can't remember the date.
Okay. So there's going to be one at the health department and then,
And one here.
and one
Yeah.
here. So not at I think they were at the library last.
I believe we did the library as well, but we don't know if we're going to do the library or not. Yep.
Okay. And
And then we'll still do our Tuesdays.
there'll be COVID vaccines available too, or no?
So we have to see if there's a place that we can get the COVID vaccine from. So we have to see if we can get the COVID vaccine. But last year, we had to get it from someone that wasn't our vaccine shop, so we have to see if we can get it from one of our distributors. Yeah.
Okay. And so I just had one other question.
Sure.
So if you look at the TB cases reported,
Yep,
and go across, disease confirmed,
yes.
so 3 for 2024, but if you go across, there's only 2 that you find.
Oh, yeah. We're missing one.
Yeah. So I would just, if Nicole can just check the
Yeah.
numbers.
Okay. She watches.
Yeah, I mean, I can't help myself, you know?
No, that's good.
I like these little charts to add up, and I always, of course, I'm always interested in the numbers.
She went back and did a last-minute change, so she went back into a last-minute change, so it probably just, yeah,
Okay.
yep. No problem. We'll fix it for
Maybe
you.
you could just let us know, well, you'll know at the September meeting the date.
Yeah, we'll have a flyer for you.
Okay,
Yes,
just so we can let
yep,
all of the viewing audience know.
yes.
How did the First Family Rest Center at the Folk Fest?
Oh, yes. We had a family rest center at the health department during Folk Fest. So we opened up the health department. So the first floor was for anybody who wanted to just come and get AC, and then the basement was for any breastfeeding or any parents that wanted to bring their kids in. So it wasn't publicized ahead of time on the Folk Fest webpage. So we probably had about 10 people come in during the weekend. So the people who came in really enjoyed it. So, and I liked the fact that I got to be not have to be in the sun the whole time. So it worked out for the people who needed to be in there. And a couple of people got to have their kids be free. So that was great.
Quick question on the substance abuse report.
Yes.
All the outreach programs, the numbers were much lower in June than May. Is that just
Yes.
vacations, or is somebody leave, or?
Yes, so we lost Maricia,
Got it.
the substance abuse supervisor, and then we have vacations that are going on as well, so people who aren't there. And also, you're also going to see a change in the report going forward as well, because we're going to have a change in the way that we do the reporting as well. So you might have a tweak going into the new fiscal year in the way that our grants are done. So we're going to try and tweak out some of the numbers for you and not have those double numbers that we used to have. So we're going to try and tweak out some of those numbers for you. So, yep. Thank you.
Conservation, not in here.
Usually, it might be over at the JFK Center.
Anything else from the board?
Move to adjourn?
We have a motion to adjourn, second?
Second.
Look at you, getting all efficient.